So KT tape, Brock tape, there's different names and labels for it, can be a useful tool for therapists to help with pain management for patients. Tape also can be useful for decompression. The idea is we're going to decompress that layer of skin, allow for some lymphatic drainage, maybe scar mobilization or nerve entrapment. Those are all useful tools in the therapy setting. Typically, when we have patients tape or we have people in the community tape, athletes, they're doing it to help mitigate pain, decrease pain, and also to help improve normal functioning and movement. When you have pain reduction, you tend to move better. So the idea of tape is to decrease that pain, to increase more normalized movement. I'm going to show you a type of taping here that can be helpful for shoulder pain. Typically we have 2 to 3 strips that we use for taping. Sometimes there's more. It depends on the body part and what you're using it for. But today Sonny's going to be my little model here, and he's going to lend me his shoulder. He has shoulder pain sometimes, but not on this side, right? Yeah.
Depends.
Depends. All right. So we're going to do 2 pieces of tape. They're going to wrap around. And these tapes you don't tend to pull. So these are called your stabilizing strips. You don't stretch those, you don't move those. The decompression strip, the one you want to pull, it just has a little bit of pull to it. This tape is pre-stretched. You might not be able to see on the camera there, but it has a wave pattern to it. And the idea is that it's stretched on the tape, and when you apply it to the skin, it's going to pull up that skin ever so slightly. And that's going to help kind of decompress those layers of tissue, help decrease pain where that layer may be. So we're doing 2 around the shoulder here. These are just stabilizing strips. You just apply them down. You don't have to pull them. Your compression strip or decompression strip is the one that we're going to be using the most to help decrease pain. So Sonny, we'll say, has a little bit of pain up here at the top of the shoulder. This is where he points to at the initial evaluation and says, ooh, this hurts right here. Anytime I reach overhead, this is where my pain is. So what we're gonna do here is we're gonna do a decompression strip there. I'm gonna rip the tape down the middle, and then I'm gonna pull it just enough. We don't have to do a big pull, just a little pull right over that segment. And then what I typically do in my evaluation, if I decide that someone might benefit from tape, is I have them repeat that painful movement. And if that feels like it doesn't hurt as much as they do it, I can say, hey, let's wear the tape. Let's keep it on for 24 hours and see how you feel. A lot of times people get significant relief as the day goes on with the tape, and they're able to do some things. Now, a couple of things you want to be careful with is the tape. You don't want to rip it off like a Band-Aid. That doesn't feel good. A lot of times I'll have people get it wet in the shower to take it off, but you can shower with it on, pat it dry, and actually wear it for up to 3 to 5 days.